Dr. Susan, and I want to tell you who she is. And she's going to tell you a little bit about why she likes the X39. So she is Dr. Susan, and she is an MD and an ophthalmologist. And so, what is an ophthalmologist? It's different than an optometrist. An ophthalmologist is an MD and actually works on the eye, issues of the eye, surgery of the eye. And Dr. Susan, I just want to thank you for coming on as an MD and also explaining to me, like, how did you learn about X39 and why are you liking it for yourself and your patients?
Oh, great. Thank you for the opportunity to share, Marcy. So I initially saw this patch on Bob, who works with me with New Skin, and I said, what is this all about? And he mentioned about it. And I had a little sore pulled muscle in my back that's been bothering me for like a year. It's not a disc. It's not sciatic nerve or anything of that nature. It's certainly not as bad as what some people on these calls are describing, but it was disabling for me enough that I was always aware of it. So basically I tried the X39 and the pain like went away. It's a lot better. And I started looking into this and did a presentation for our Eye Society meeting and found out more about how it works, read some of the science behind it, the GHK copper peptide stimulation. And I started thinking, it works on stem cells and it works on other things. I have patients as an MD in ophthalmology, which is eye surgery and so forth. We have people that we treat with chronic diseases, neurological degenerations. We've got glaucoma, we have cataracts, we have a lot of other things. So what happens here is that we're always looking for things to supplement what we're doing for patients. And I'm not suggesting that this would in any way replace what someone is doing as far as glaucoma care or management or replace surgery. So basically, what it does is it stimulates stem cells. And I think I'm positioning it with patients of mine who have chronic conditions like glaucoma. They're on meds. They're in danger of losing more vision. And we have them on max everything, including surgery. And I think this might be something that would help their cells to remain somewhat more viable. And someone just posed a question about retinitis pigmentosa. That is a hereditary degenerative retinal disease that there are some genes that are missing, and that's why people get that. I don't know the science behind if any of our patches work for that, but just stem cells in general would be good for, hold on a second, I just lost the feed here. Stem cells in general are good for helping with these conditions. So I don't know that there's anything that would reverse that. We do have some data about some types of retinitis pigmentosa that can be changed with gene therapy, replacing the defective gene. But I don't know about the patches. I'm not sure that that's been studied. I just think overall health to decrease oxidative stress on the body, like macular degeneration that comes from blue light and smoking and things like that, this would be helpful too. It's just as an adjunct to your overall health, but not to replace anyone's medications that they're taking or surgery that's been recommended. I think it all works in harmony. It works together. But I've been very impressed with it. I know people that I put on it who have been having remarkable results as far as pain and energy level and so forth. And I use it every day. I think it's really valuable.
And it's so nice, Susan, to have an MD who does all what you do for your patients, but also sees the benefit of photobiomodulation, like light making change in your body, like something progressive to work with your tools in the box. And I love that is working for you and is working so well that you now recommend it to your patients. And doctor, thank you so much for coming on and sharing.
Thank you for the opportunity to do that, Marcy. I'm so happy to help. It's just such a marvelous invention.
Thank you.
Really.
Susan. We're going to go now